Deonde Vatsan, welcome to our webinar on Federal Fiscal Year 2023 to 2025 Tribal Child Care Development Fund Plan Preprint Overview. Deonde, I hope it's a beautiful day wherever you are. Before we get started, I just wanted to go over a few logistical items. Just want to welcome everyone. I know we have people logging into the room. Just so you know, this webinar is being recorded and a recording will be posted online later. The copy of these webinar slides will also be made available online and will be sent out as a follow-up to all of the registered participants following the webinar. We encourage you to enter any questions that you might have as we go along into the chat box. And we look forward to hearing from all of our speakers today. Very exciting to be here on behalf of the Office of Child Care's newly launched Tribal Child Care Capacity Building Center. And we wanted to let you know that all audio and phone lines will be muted to reduce background noise. There will be some poll questions throughout our presentation today. And while we get started, we invite you to introduce yourselves in the chat box. Just let us know who's here, your name, your title, and the tribe or tribal program that you represent. And we look forward to our time together. So let's get started. Let's go over our agenda for today. So first, we're going to start with an overview of the draft FFY 2023 to 2022 Tribal CCDF Plan Preprint, which can be found at the link on the screen, and we'll drop that link into the slide, into the chat box as well. Next, we're going to go over the public comment process, the 60-day public comment period, and finally, the plan submission deadline. And so now I'm very pleased to introduce Dr. Ruth Friedman, the Director of the Office of Child Care, for our welcoming remarks.
Thank you so much, Melody, and welcome everyone. I'm so happy to be with you today. I'm just going to say a quick hello and let you get back to the heart of the program, but I wanted to welcome you to this webinar. I wanted to also acknowledge the incredible impact that the pandemic has had on tribes and tribal communities. We know this continues to be a struggle, and we are hoping to be here to help in any way we can to support you getting your child care services up and running and supporting your families. OCC remains committed to supporting our tribal CCDF lead agencies through focused and targeted technical assistance and other support, especially when it comes to spending these supplemental funds as we come out of the pandemic. I do also want to acknowledge the new Tribal Capacity Building Center that was just awarded. We really encourage grantees to provide input on how the new PA Center can best meet and support your needs. So we are really open. I know there's not time on the agenda today, but really would love to hear from you on the best ways we can be using this TA Center to support you. Turning to our agenda today, as you know, tribal lead agencies are required to submit a CCDF plan every 3 years in order to receive CCDF program funds, and tribal lead agencies use the approved CCDF plan preprint as a template to describe their plans. We know that each tribal CCDF program is unique and is designed to meet the needs of children and families in your community. Since the last CCDF plan preprint was released, OCC staff have been working to refine and streamline the preprint in order to incorporate recommended changes from all of you. We heard during the last plan submission that the tribal plan was a burden. And so we have since overhauled the way the tribal CCDF administrators submit the plan, and we are hoping this helps. We have also taken the feedback you and your tribal leaders gave us during the tribal consultation back in May, earlier this year. So today we're going to provide an overview to the refinements we've made to the plan preprint. which we hope will give you all enough information to review the preprint on your own and determine if the questions in the preprint allow you to describe your CCDF program. Following the webinar, we encourage you to submit any comments to the Federal Register notice, which is currently open through mid-December. The email for submitting these comments is provided at the end of the webinar, and I really encourage you to please let us hear from you. It really is so helpful to our process in making sure that we make sure this program works for you. So as I said before, OCC is committed to supporting tribal lead agencies. We will be holding a series of webinars and trainings early next year to prepare for submitting your next tribal plan. These CCDF plan submissions next summer will be an important part of showing how you are responding to the childcare needs in your community and using the various CCDF funds to provide childcare services. Thank you so much for attending today, and thank you in advance for any comments you are able to provide on the preprint. And now I will pass it back to you, Melody. Thank you.
Thank you so much for that, Dr. Friedman. I will go ahead and transition us over to our next slide, and I will hand it over to our first presenter today and the rest of our speakers. And so, Rachel, I will pass it over to you.
Thank you, Melody, and thank you, Dr. Friedman, for your opening remarks. And good morning or good afternoon to everyone who's joining the webinar today. So my name is Rachel McKinnon, and I'm a program specialist in the Planning, Data, and Policy Division in OCC. So let's go ahead and get started with an overview of the preprint. Let's go to the next slide. So what is the Tribal CCDF Plan preprint? Every 3 years, tribal lead agencies submit their CCDF plans to ACF. This is a description of the policies and procedures for their CCDF programs. The preprint is the template tribal lead agencies use to describe how they meet all of the CCDF requirements in the law. The plan submission acts as the application for tribal lead agencies to receive CCDF program funds. I would note that tribal CCDF programs funded under an approved 102.477 plan are not required to submit a plan directly to ACF. Let's go to the next slide. So here we have a poll, and I think we can go ahead and launch the poll. The question here is, have you completed a tribal CCDF plan before? Yes. No, this will be my first time. Or no, I do not work on the tribal CCDF plan. So if you could go ahead and let us know where you fall on these options. This is just to give us an idea of, where folks are starting from as we talk about the plan preprint. Oh, I see comments coming in, responses coming in from the comments, which is helpful. And I'm not sure where we are on the poll where people can select an option, if we can show results for that. Oh, well, it looks like for most folks on the call that that they have completed the tribal plan preprint before, which is great news. For those who are filling this out for their first time, that's fine. We have a lot of supports planned in the upcoming months to help you through this process and make sure that you're able to describe your plan. We can go ahead and close the poll and go to the next slide. So I wanted to talk about, so here's an overview of the changes that apply to the entire preprint. So as Dr. Friedman said in her opening comments, during the last plan submission and in consultations and listening sessions since then, we heard that the fillable PDF format was difficult to work with. So we're moving to a plan submission process in the Child Care Automated Reporting System, also known as CARS. And this is an online system that folks will use to submit their plans. And so this will hopefully resolve many of the issues that we saw with the PDF, the fillable PDF. This also means that we've dropped the amendment log as an appendix because the amendments will be tracked in the CARS system rather than through a separate appendix. And I can see that the CCDF folks have dropped the email for CARS TA into the chat. So if you're having any problems with that, you can reach out to them and then they can give you support in setting up an account or getting access to the system. So we also know that each tribal CCDF program is unique, and we've tried to design the preprint in a way that allows for more flexibility in describing policies and procedures. So as you read through the preprint, think about if you would be able to describe your program with the questions that we're asking. As much as possible, we tried to reduce the number of describe boxes and change them to check boxes. We hope that this will make it easier and faster to fill out the preprint. Let's go ahead and go to the next slide. So throughout this presentation, you will hear us talk about small, medium, and large allocation sizes. Tribal lead agencies have different CCDF requirements based on the size of their allocation or the amount of CCDF program funds they receive in a year. Tribes with small allocations are exempt from the majority of CCDF requirements, including providing direct services to families, ensuring equal access to families, and consumer education requirements. This also means that tribes with small allocations don't have to fill out the entire CCDF plan preprint, and we'll get to more on that later. Tribes with medium allocations follow most of the same requirements as the tribes with large allocations. However, they do not need to operate a certificate program. And finally, tribes with large allocations are subject to the majority of the CCDF requirements, though there are still some exemptions that apply for all tribal CCDF programs, like maintaining a website. Let's go ahead and go to the next slide. So currently, allocation size thresholds are based on FY 2016 funding. Since then, there has been a large increase in tribal CCDF program funds, and the thresholds need to be adjusted to account for these increases in funding. So we would really like to get feedback about these changes. Currently, allocations less than $250,000 are small allocations. Allocations between $250,000 and $1 million are medium allocations, and allocations greater than $1 million are large allocations. So we present a few options here, but are also open to hearing other suggestions. The first option would be to use the same thresholds with the FY 2020 allocation sizes. That means that tribal lead agencies that had increases in their allocations between FY 2016 and FY 2020 that pushed them over the $250,000 threshold would go from having a small allocation to a medium or large allocation. This also means that those tribal lead agencies would be subject to more of the CCDF requirements. So by using this option, 63 tribal lead agencies would go from having a small allocation to a medium or large allocation. So the second option would be to keep the same number of tribal lead agencies in each allocation size. So 153 tribal lead agencies had small allocations with the FY 2016 allocation. And using this option, the same number, 153 tribal lead agencies, would have a small allocation using the FY 2020 threshold. So not all tribal lead agencies would keep the same allocation size because some tribal lead agencies grew faster than others, but the allocation sizes themselves and the requirements would stay mostly the same. So the third option we are presenting here would increase the thresholds by the average increase in allocations. For example, tribes with small allocations, on average, increased by about $200,000 from FY 2016 to FY 2020. So using this average increase, we would increase the threshold for small allocations by that much, which would move it to $550,000. So under this option, about 14 tribal lead agencies that used to have small allocations would have medium or large allocations and would be subject to more CCDF requirements. And okay, let's go to the next slide. So we have another poll question. We could go ahead and put that up on the screen. So the question asks, what is your preference in determining future allocation sizes? So you can use the actual polling screen in front of you to select an option. So we have keeping the same threshold, maintaining the same proportions, increasing each allocation size by the average increase, or if you need more time to think about this. And if you do need more time to think about this, or even if you don't and want to respond through the public comments, we welcome that. So this is one of the areas that we would really appreciate additional feedback from folks, either through the official public comment process or in the chat here. So let's go ahead and go to the results if we're ready for those. All right, well, it looks like around the same number of folks would prefer to maintain the same proportions. So that would mean that the allocations would stay mostly the same, or to increase each allocation size by that average increase. But we also have about a third of the group who need more time to think about this, which is totally reasonable. And please, take some time to think about it and respond through the public comment process. We can go ahead and close this poll and go on to the next slide. So now I'm going to give an overview of the different sections in the plan preprint. And then we'll dive a little bit deeper into each section to talk specifically about what refinements we made in each section. So to begin, all tribal lead agencies complete sections 1 through 3. These sections include describing the CCDF program leadership and coordination, health and safety requirements for standards, training, and monitoring, which includes comprehensive background checks, and activities to improve the quality of the CCDF program and services. Tribal lead agencies with small allocations also need to complete section 4. This is an abbreviated section to describe their subsidy program. Tribal lead agencies with medium or large allocations must complete sections 5 through 7, which provide a little bit more detailed description of how their child care subsidies are provided to children and families, how tribal lead agencies ensure equal access to childcare, and how tribal lead agencies engage parents to inform them about the CCDF program policies and procedures. We have these 3 sections at the end that we won't be talking about that much, but I wanted to include them here as a preview for discussions we'll have later in the plan writing process. So Appendix 1 and 1A are about submitting child counts, which is part of the plan submission process. Here they're included as appendices for the plan preprint, but they will be added as modules in the online card system. So both the tribal lead agencies who receive CCDF program funds directly from ACF and tribal lead agencies that operate their CCDF program under an approved 102477 plan must complete the child count declaration. We also have an appendix here for the Tribal Early Learning Initiative, or TELI, and this is an optional approach that tribal lead agencies can use with their CCDF program funds. This is a rethinking or modern use of the TELI project that tribes may have participated in the past. So we don't have time set aside in this webinar to talk about the TELI project, but we will provide a lot of information about what the TELI project will involve and how to apply for those activities or for that project in future webinars. Great, and we can go to the next slide. And I am going to turn it over to Francis Pedraza to get us started off on a deeper dive into the preprint section.
Thank you, Rachel. You can go to the next slide. So I am Frances Martinez Pedraza. I'm an SRCG fellow at the Office of Child Care within the Program Operations Division. We're gonna get started with section 1. And section 1 is the section where you will be defining your CCDF leadership and coordination with the relevant systems. As Rachel mentioned at the beginning, this section applies to all tribes. So that means it applies to tribes with small, medium, and large allocations. This section includes 10 subsections, as you can see in the slide, for tribal lead agencies to provide information on how their CCDF program is administered, including the designated tribal lead agency and administrative structure. It also addresses who was consulted in the development of the tribal CCDF plan. And additionally, in this section, tribal lead agencies also define their Indian child and Indian reservation or service area, their child count, the type of CCDF childcare providers that they have within their programs. And finally, the section asks tribal lead agencies to describe their plans to coordinate CCDF services with other entities, their processes to ensure program integrity and accountability, and information related to their disaster preparedness and response plan. You can go to the next slide. We wanted to highlight a few key changes to this section. So the first one relates to subsection 1.6, which is related to the child count. And one of the main changes that you'll have for this section is that Appendix 1 and Appendix 1A, which is the appendix that applies to 477 tribes, both of those appendices will be submitted through the CAR system, so electronically. In addition to that, in subsection 1.7, this represents a new section and a new question in the tribal plan preprint, and it asks about the types of CCDF providers, and we'll preview that question briefly for you in a few minutes. And finally, the other key change of this section is that we move the disaster preparedness and response plan questions, which were previously in section 2, are now the last subsection of section 1. You can go to the next slide, please. So here is the new question that you'll see in section 1, which is 1.7. And in this question, you'll select the types of providers that offer services directly to families and children in your tribal CCDF program. And there is an option at the end if your tribal lead agency does not offer any direct services, you may select that as well. And you'll select here any of the options that apply to your program. So now I'm going to pass it on to Acta, who will be discussing section 2.
Great, thank you, Frances. Next slide, please. I am Agda Burchard. I'm currently the Regional Program Manager in our Region 3 office in Philadelphia. And previously, I was a Program Specialist for the Office of Child Care in Region 10 in Seattle. Had the wonderful opportunity to work with many of the CCDF administrators. And I'm so glad to see all your names in the chat and the greetings. Greetings to all of you. I miss you. Section 2 is on standards and monitoring processes to ensure the health and safety of childcare in the childcare settings. It includes health and safety standards and training requirements for CCDF childcare providers, monitoring and enforcement policies and practices for those providers, any exemptions that you have for relative providers, as well as a comprehensive background check information. Next slide, please. Some of the key changes in this section include the combining of health and safety standards. And again, a reminder that the standards are the practices that you require childcare providers to implement in the program related to health and safety. Those standards are combined with training requirements that you have based on that topic. So for example, there'll be a question asking about infectious control or prevention of prevention. Sorry about that. I'll jump to another topic such as pediatric first aid and safety. So you put a description of the standards as well as the training. Another key change here was that the monitoring and enforcement, so for example, descriptions of your inspections of those health and safety requirements are described by provider type because we really realize that those monitoring and inspection processes might vary depending on the type of program. For example, in a tribally operated center or a program that's licensed by the tribe as compared to a program that's licensed by the state. And then the last key change was that exemptions for relatives were combined into one question instead of spread throughout this whole section 2, except for background checks. And just a reminder that CCDF defines a relative as the child's grandparent, great-grandparent, aunt, uncle, or the child's sibling if that sibling lives in a different residence. And tribal lead agencies have the flexibility to exempt those relatives from some or all of the health and safety requirements. Next, I'll turn it over to Rachel.
Hello again, everybody. I will be talking to you about the comprehensive background checks. This is the next section that is within the health and safety requirements section. So there are 8 different background checks that tribal lead agencies are required to conduct for all child care staff, including a state or tribal fingerprint check and an FBI fingerprint check. So this section describes how each of the checks are conducted for the different types of provider in the tribal CCDF program. So tribal lead agencies must also describe disqualifying crimes for employment eligibility, who pays the fees for the checks, timeliness and privacy in returning the results, provisional employment after the checks are submitted but before the results are returned, an appeals process for child care staff that has had negative results, and then a justification for any alternative approaches used by the tribal lead agency. Let's go to the next slide and we can talk about the changes in this section. So the changes in this section are more than in any of the other sections. We heard a lot in the last plan submission cycle that the background check section was very difficult to fill out, that the questions were too general to know where to focus the narrative responses, and also not always relevant for the specific circumstances for tribal lead agencies. So as much as possible, we have tried to move from open-ended questions to questions that can be answered with a checkbox. In some cases, we have included checkboxes for the most common responses, as well as an optional describe box in case the checkboxes don't include the option that you use. So again, when reading through this section, keep in mind whether or not you're able to describe your particular program using the format that we've presented. So in addition, we've included specific alternative approaches throughout the background check section, instead of leaving just one open-ended response for alternative approaches. So this way, the tribal lead agencies have an idea of what alternative approaches are appropriate. And there's still a question at the end of the section to justify using the alternative approach. The next slide. Great, and now I'm going to turn it over to my colleague, Amy.
Hello, everyone. I'm Amy Stevens. So I am a program specialist in Region 7, located in Kansas City, Missouri. Good to see you all on the call today. And I am going to go over Section 3, which we do not have a lot of changes in Section 3, so it should be fairly brief. But Section 3 covers quality improvement activities. So these include things such as training and professional development, early learning and development, quality evaluation, other measurable activities, and it can also include culturally responsive activities such as language programs. And then Section 3.2 looks more specifically at training and professional development of the child care workforce. So if we could go to the next slide. And here we'll look at our, we have 3 key changes that we made in this section. First, Table 3.1 was changed to reflect our current quality set-aside percentages. So these reflect the percentages that are current now. The previous table had some former percentages. So now, just as a reminder, what this table shows is that all tribes have a quality set aside of 9% of their CCDF expenditures are to be spent on quality improvement activities. And then tribes with medium or large allocations in addition to that also have a 3% set aside for infant and toddler quality initiatives. And so the table was changed to reflect those current percentages. In Section 3.1.2D, this question is asking what quality improvement activities the tribe or tribal community will invest in over this plan period. And we added space within this question for you to also write about your stabilization subgrants. So that would be the place where you talk about the work that you're doing through those subgrants. And then finally, in Section 3.1 or question 3.1.2F, this question is asking specifically about health and safety. And so we added some examples here that would include personal protective equipment, obviously some things that are now very common in all of our worlds due to what we've learned over the past couple of years. So we just added some examples here of health and safety equipment that you might spend quality funds on. So those are the 3 main changes that we made to Section 3. And with that, I will pass it on to Kurt.
Thank you, Amy. Good afternoon, everybody. And good morning for those on the West Coast. My name is Kurt G. I'm a program specialist in the Region 9 office in San Francisco. And I'm going to be going over Sections 4 and 5 today. So Section 4 is only to be completed by tribes with small allocations. As many of you know, the final rule exempts tribes receiving small allocations from the majority of CCDF requirements. So tribes with small allocations have some additional flexibility in how they choose to spend their CCDF funds. They can focus these funds on health and safety areas or quality. And also, as you see on the slide here, tribes with small allocations have the option to offer direct services, including setting their own eligibility requirements. Next slide. So a few key changes in Section 4. We tried to provide more clear instructions at the beginning of Section 4 to describe the flexibility that tribes with small allocations have. Also, one of the major changes to this section was that we added optional sections to describe your eligibility criteria. I think that was a major challenge during the last plan cycle, where we went from having kind of a framework of eligibility criteria to one narrative question, which had you put all of your eligibility criteria in one text box. And that was challenging, I think, for many grantees and frankly for regional office staff as well. So we added an optional, several optional sections that you can use to describe your eligibility criteria if you find that to be helpful. And we also added a clarification around when a sliding fee scale is needed, which is for tribes that choose to assess a parent copay, which is optional for tribes with small allocations. So next slide, please. We're now going to move into part 2 of the plan, which covers sections 5, 6, and 7. And these sections are only required for tribes with medium and large allocations. Next slide. So I'm going to talk a little bit about section 5, which is the section on providing stable childcare financial assistance to families. This includes your eligibility criteria for children and families, the application and eligibility determination, redetermination process, as well as steps for improving access for vulnerable children and families in your priority areas. And lastly, it covers family contributions to payments. Next slide. So there were a few key changes in section 5 as well. We clarified at the outset that tribal lead agencies that use categorical eligibility need to still ensure a couple of things. First, they need to still ensure that children meet the tribe's Indian child and service area definitions in order to be eligible for services. That was in a totally different section before in section 1. It still shows up there, but we wanted to bring that back to make sure that tribes are still determining those two criteria to make sure that children are eligible for services. And we also have a section, a new question that asks you to describe how the provision of services goes to those with the highest need. And both of those requirements weren't as detailed in the last plan. We also added a hybrid option for tribal lead agencies that may choose to use standard eligibility criteria and categorical eligibility. This might come up in tribes where they have different eligibility criteria in different parts of their service area, or this might also come up for consortia that might have different eligibility tracks among different participating tribes. And lastly, we asked tribal lead agencies to include the definition of attending within the definitions of job training and education. It was always confusing to have tribes define job training and education and then to define what it means to be attending job training or education. So we tried to cover those together to make that a little bit more kind of easy to work with for you all. Next slide. And I'm going to turn it over to Andrew in central office.
Hi, everyone. My name is Andrew Lee, and I'm a management analyst who supported the tribal CCDF plan preprint work group. And I worked on section 6, equal access with Janet File. And the following topics are covered under section 6. So we have 6.1, description of direct child care services, 6.2, assessing child care market rates, 6.3, establishing adequate payment rates, and also 6.4, implement generally accepted payment practices and ensure timeliness. Next slide, please. And so there were relatively light edits to the equal access section, but here are the highlights. First, CCDF direct services may be provided by tribal lead agencies through grants or contracts that allocate slots with childcare providers. Tribal lead agencies that use grants or contracts will check boxes to indicate if the grants or contracts are a strategy to increase the supply and or to improve the quality of childcare for specific populations of children, such as children with disabilities or children experiencing homelessness. Next, in order to increase payment rates for targeted needs, tribal lead agencies, can choose to establish either tiered rates or rate add-ons, also known as differential rates. In section 6.3.5, checkboxes were added for tribal lead agencies to indicate if they have tiered payment rates or differential payment rates to address specific needs. Lastly, for section 6.4.3, tribal lead agencies' payment practices must reflect generally accepted payment practices of child care providers who serve children who do not receive CCDF subsidies. And so checkboxes were removed so that tribal lead agencies must describe paying on a part-time or full-time basis rather than hourly, and paying for reasonable mandatory registration fees, or they must describe why those practices are not generally accepted. And that concludes the key changes to Section 6. Next, I'll turn it over to Agda.
Great, thank you, Andrew. Next slide, please. Section 7 is on promoting family engagement through outreach and consumer education. This includes a parental complaint process, consumer education for parents, providers, and the public, monitoring and enforcement policies and practices for CCDF providers, additional consumer and provider information that the Tribal Lead Agency provides, procedures for providing information on developmental screening, and lastly, consumer statement for parents who receive CCDF program funds, a consumer statement regarding the child care provider. Next slide, please. The key changes in this section include OCC acknowledging that the responses may differ for a tribal lead agency based on the provider type and who conducts the monitoring. So for example, the process for parental complaints or the process for providing monitoring and inspection reports to parents, it might differ for those providers that are licensed by the tribe, or for those providers that are licensed by the state, or for the tribally operated center. So we really wanted your feedback on, is this gonna make it easier for you to respond based on the type of program you had? Another key change here was that to make this section easier for tribal lead agencies to complete, a lot of checkbox options were added. So when the tribal lead agency is asked to provide information about different topics that you're providing to the consumers, the parents, the public, and providers, if applicable, there's different options that you could just check indicating how that information is provided, and some potential partners that you could check that, yes, we partner with Indian Health Services, for example, to provide that information. And there are also checkboxes that were added to the section about the consumer statement and what types of information are on the consumer statement and how it's provided to parents. And then lastly, we eliminated an unnecessary question about additional providers that are on the tribal lead agency's list of providers that you give to families. And then I will go ahead and turn it over to Rachel for our next slide, please.
Great, thank you, Agda. So I know that this has been a whirlwind of an overview for the plan, and there's a lot of information here that we have put into this webinar. So this next section will talk about how to submit public comments for the public comment process. But we are also, there have been several questions in the chat about whether or not these slides will be made available. And yes, they will. In a day or two, we'll go ahead and send out a link to both the slides and the recording. But you can also go to the OCC website and download the draft preprint so that you can see the questions that we've been talking about and hopefully provide some comments about them. So let's go to the next slide. So the request for public comment on the plan preprint published on October 15th. So this means that the 60-day public comment period will end on December 14th, 2021. So that gives you just about 1 month left to submit your comments through this official process. And there will be a second public comment period for 30 days. But I want to draw special attention to this 60-day public comment period. We would prefer that you send in your comments in this first period because we will need to respond to all of those comments officially. And so we can make sure that we get those public comments and that we're responding to them. We're also capturing we'll capture all of the questions and comments that have come in through the chat. We definitely won't have enough time to get through all of them, but we're a little bit limited on time, so we won't be able to spend a lot of time on them. But we will use these comments as well in thinking about how to further refine the preprint. Also, if there's anywhere that we need to pay special attention to during the training to provide additional technical assistance, this is information that's really useful for us to have. But in terms of responding to specific issues about the preprint itself, we would love to get those in through the public comment period, or through the public comment process, to have that more official public comment for us to address. So let's go to the next slide. So you can either mail your comments to the address listed here, or email them to this email address. And I know this isn't a lot of time to jot down all this information or even copy and paste it out of the chat. But again, this information will be, these slides will be made available to you after the webinar, to you and to anybody who's registered for the webinar. And let's go to the next slide. So we have one more poll question for you. So we can pull the poll up, great. And in this question, we ask, have you reviewed the preprint and provided public comments? The first response, you can say yes. The second response is no. And the third response is no, but planning to prior to the deadline. I do see some comments, people entering their responses through the chat. You can also do that through the polling feature. Like I said, we would be really thrilled to be able to hear from people who are going to be using the preprint to describe their CCDF plan, to understand how we can improve on the preprint we already have. So let's go ahead and close the poll. And it looks like not a lot of folks have had a chance to review the preprint already. Thank you to those who have. And it looks like the overwhelming majority plan to review the preprint prior to the deadline. So that is really exciting to hear. And we look forward to getting those comments. So I think we can close that poll and go to the next slide. Oh, so as Dr. Friedman said in her opening comments, this is just the beginning of additional technical support and training that you all will receive from OCC and from TCBC as you prepare for the next tribal CCDF plan submission. So as a reminder, the plan submissions are due on Wednesday, July 1st, 2022. And I know that feels like a long time away, but anyone who's filled out this preprint before knows that that is almost no time at all, and it'll be done lickety split. So you can anticipate hearing from us in the new year for webinars and trainings and preparations for your child count and more information about the TELE project. And let's go to the next slide. Great. Well, I think that the team rushed through a ton of information, so we have a little bit of free time here at the end. I have asked Francis to keep an eye on the chat for any kind of clarifying questions that we might be able to answer here on the webinar. And before I turn it over to her, I would remind folks that if they have questions, they can feel free to reach out to their OCC regional offices to get support on any of these things or to answer these questions. Also, the new Tribal Center is full of great people with lots of information that will be able to help you out with this. And I just saw a question come in about the child count. And the child count will be due at the same time that the plan preprint is due, or the plan submission is due, which is July 1st. So I'm going to open it up to the rest of the OCC tribal preprint work group who've been presenting here. And Francis, if you saw any questions that would be useful for us to clarify now, we can respond to those in the few minutes that we have left.
Sure, we have a few questions here. The first one was, if there is no amendment log, how is the approval process completed?
That is a great question. All of that process will be through the online system. There will be functions that when you submit your plan or your amendment, you can, a message will go to the regional office to review that. So it's a lot of the same processes, but instead of being on paper and through email, it'll be through this online CARS system. And we'll have more technical trainings on how to use the CARS system as the different modules within the system roll out.
Right. There was also another CARS question about like the applications still pending. So I think Melody shared in the chat the like an email where you can send any CARS questions, and maybe we can share that again with everyone in the chat. In addition to that, we had a few questions come in regarding the allocation sizes conversation. And one of the questions was if they can find out if their tribe would move up, or if they're going to be informed if they move up to medium, as it would be helpful sooner rather than later, as it makes a huge impact on writing their plans.
I think that's a really great question. As we we expect to be making decisions around the same time that we are finalizing the preprint. And so we know that this will be useful for folks to have when they're filling out the plan. So we will, as that decision is made, we'll roll out that information out to people. You can look at your total allocations for 2020 to get an idea of whether or not you would, if you were a small allocation tribe, a tribe with a small allocation, and if you would be moving to a medium or large allocation. I think the number that I used in the presentation for option 3, which would be if there was an average change, was 550,000. So if your 2020 allocation was more than 550,000, then it's likely that your allocation size would be a medium allocation.
There was also a question specific to the comprehensive background checks section and to the appeals subsection within that section. So if we use the state system to do the background checks, do we still have to develop an appeals process? And if we have not authority over the state agency that determines the results for background checks? I don't know if there's anyone in the call who could address that.
Well, I think actually it looks like some folks went on off mute. Who might want to answer?
Oh, this is Agda. I'll jump in there briefly, and I'll also point out another tribal lead agency shared how they handled that, and they did include information about the state's appeals process. And I just wanted to remind people too that this question is asking how a applicant or a child care provider would appeal the results of their background check. Not the results, but the accuracy. Was the information accurate in the background check? So typically then that does have to be done by the entity that does that check, because they would have the accuracy or the inaccuracy of the information. So I think that is definitely an area where if you feel the question, the way it's worded now in the preprint isn't going to work for your tribal lead agency, that you give us some feedback on how to reword that question. And in many cases, you may need to get that information from someone else, the entity that's actually doing the checks.
No, I was just going to throw out there, I believe this question came from a tribal CCDF lead agency that I work with in California. And in California, where most of the tribes rely on the state's background check system, I think in those cases, it does make sense to describe the state appeal process because they're the ones that are doing the background check to begin with. So I thought the advice from another tribe of, copying and pasting from the state plan, could be a helpful approach.
There was another question regarding whether there would be any in-person trainings planned for regions.
I think that the format of the trainings is still TBD. I think that we are still, in a transition period of understanding how the coronavirus is affecting our day-to-day activities and whether or not that's a good idea to bring folks together for the training. I would say for most people on the call that in-person trainings would be preferable because we know relaying information in that way is better for everybody. But we don't know as of yet.
Two more questions. I think we might be able to answer one or both. Let's see. Is there a way to include the essential workforce in eligibility? Many employees of our tribal government are not Native American.
Do you want me to handle this one, Rachel? I was just going to throw out there that kind of the base eligibility, even for tribes with small allocations, is that the child needs to meet your Indian child and service area definitions. So if they weren't Native employees, if they didn't meet your Indian child definition, then they wouldn't be eligible. You'd have to find some other funding to be able to serve those families.
Thank you, Kurt. And the next question is related to equal access. Does this section or any other support children in foster care settings being raised by relative of donation?
I don't believe that this is directly addressed in section 6 specifically, but I think that it is covered in section 5. I think it's 5.1.4, eligibility based on protective services and membership in vulnerable populations.
Great, thank you so much, everybody. Let me just use these last few minutes to close us out. I want to thank everybody who joined us for this webinar, everybody who has entered questions or comments into the chat. Again, this entire webinar is to prepare you all to be able to provide us feedback on the preprint. So we want to make this a document that you can use and that is useful for you. And in order to do that, we need the feedback from you all to know where we can improve it and make it better. But thank you so much for joining us this morning, this afternoon, depending on where you are. And we're really excited to engage with you over the next 6 months to get everyone, working on those plan submissions and making sure that you have all of the information and resources and tools that you need to be able to do that. So thank you again for joining us. I saw a comment come in about downloading the chat and about how if you look at where you type in your message into the chat, there's like a picture of a page, a smiley face, and then 3 little dots. And if you press those 3 little dots, it should give you an option to save the chat. So hopefully folks are being able to pull down the chat if they want. We hope to hear from you through the public comment process so that we can respond to each of your comments. And we will talk to you again soon. Thank you so much.